Are there serious contraindications for beta blockers in PTSD? Imagine a medication that might help calm some of the physical symptoms of trauma, like rapid heartbeat or trembling. That's where beta blockers come in. They are drugs like propranolol that block certain signals in the nervous system. They are sometimes looked at for treating post-traumatic stress disorder because they could reduce the body's response to traumatic memories. But are there serious reasons why some people should avoid them? The main contraindications for beta blockers are related to heart and lung health. If someone has a very slow heart rate, known as bradycardia, or low blood pressure, called hypotension, they should avoid these drugs. People with certain types of heart block, especially second or third degree atrioventricular block, should also steer clear. These conditions can make beta blockers risky because they can worsen heart rhythm issues or cause fainting. People with hypersensitivity to beta blockers, meaning they have allergic reactions, should not take them either. In addition, those with cardiogenic shock, a condition where the heart suddenly cannot pump enough blood, should avoid beta blockers because they can make the situation worse. When it comes to respiratory issues, things get a little more nuanced. Non-selective beta blockers, which affect more than one type of receptor, are usually avoided in people with asthma because they can cause bronchospasm, making breathing difficult. However, cardioselective beta blockers, which mainly target the heart, might be used cautiously in people with mild to moderate respiratory conditions, but only under careful medical supervision. In the context of PTSD specifically, beta blockers are not contraindicated outright. They are not automatically off-limits. Some studies have looked at propranolol for reducing traumatic memories and symptoms, with mixed results. Most side effects that lead to stopping the medication are related to cardiovascular or systemic effects, not PTSD itself. There have been reports of psychiatric side effects like depression, sleep problems, or even psychosis, but the evidence is inconsistent. These are not considered absolute reasons to avoid beta blockers in PTSD patients. Doctors often use them off-label for anxiety, but guidelines do not strongly recommend or forbid their use for PTSD. Instead, they emphasize careful, individualized assessment. In summary, the serious contraindications for beta blockers are mostly the standard heart and lung conditions that apply to anyone. There are no specific contraindications tied solely to PTSD. Still, anyone considering beta blockers should have a thorough medical evaluation. They can be part of a treatment plan if the benefits outweigh the risks, especially when managed by a healthcare professional. If you or someone you know has PTSD and is thinking about this option, always consult a doctor who can evaluate personal health history and determine the safest approach.